Hello and welcome to PTA 101, Introduction to Physical Therapy. My name is Cam Williams and I'll be your professor, and my contact information is on the course syllabus. This course will cover the field of physical therapy, its history, and the role physical therapy plays in the healthcare system. The practice of physical therapy and laws which regulate the physical therapist and the physical therapist assistant are discussed, as well as the boundaries between the physical therapist and physical therapist assistant in clinical practice and education. We will examine the American Physical Therapy Association, the prime representative group for the profession, and look at common practice settings for patient care. As we move forward, I will at times use the abbreviations PT for physical therapist, PTA for physical therapist assistant, and APTA for the American Physical Therapy Association. Also, we will examine basic medical abbreviations used in the profession and the standards of ethical practice. As you review the course syllabus, you will find the objectives of the course, as well as the schedule of readings, assignments, and tests. In addition, you will find the grading scale and other policy information. Please review this as soon as possible so you can plan your activities accordingly. For example, you have a healthcare provider interview assignment which is due mid-semester, and you also have appendices with medical abbreviations and terms which you should begin to memorize. So again, please review your syllabus and schedule to plan ahead. If you have any questions, please don't hesitate to contact me. Now let's get started. So if I were to ask you what is physical therapy, how would you respond? Some people might say PT helps people recover from injury, decreases pain, essentially to help someone get back on their feet. But to be more specific, the American Physical Therapy Association's position statement explains the profession in detail. And here's the definition. Physical therapy is a health profession whose primary purpose is the promotion of optimal human health and function. This purpose is accomplished through the application of scientific principles to the processes of examination, evaluation, diagnosis, prognosis, and intervention to prevent or remediate impairments, functional limitations, and disabilities as related to movement and health. You can see I have terms highlighted in red font. These are the main points: that physical therapy is a profession in which we use interventions to enhance movement with the goal of promoting optimal human health and function. In essence, PT helps people move better, no matter what their condition. These can be individuals of any age with a myriad of conditions. Some examples include a 2-year-old child with a developmental disability, a 16-year-old athlete with a sprained knee, or a 75-year-old who has suffered a stroke. All these patient types can benefit from PT as we help them move better. So I have stated that PT is a profession, but just what is a profession? If I were to ask, what are the components or characteristics of a profession, what would you say? And what would you say about what's the difference between professional and professionalism? Well, we will see the components of a profession by definition. It is important for you to understand how a profession is defined so you can more fully understand the differences and boundaries between the physical therapist and physical therapist assistant. So the first component is lifetime commitment. PTs and PTAs rarely leave their profession. Most are committed to physical therapy as a career versus a job, and this is a typical component of a true profession. Second, a profession must have a representative organization. The APTA fulfills the role in physical therapy. Third is specialized accreditation. The accrediting body for all PT and PTA programs is the Commission on Accreditation in Physical Therapy Education, and this organization assures post-baccalaureate and associate training for PT and PTA programs respectively. The next component is service to clients, and all professions have this, and this provides social value. And lastly is autonomy of judgment, and this means freedom to make decisions. Autonomy of judgment is inherent in every goal, treatment plan, and discharge plan in physical therapy. This autonomy is what separates the PT from the PTA. PTAs do not have the autonomy to diagnose, develop goals, or develop a treatment plan. Therefore, PTAs are called paraprofessionals. Para meaning at or to one side of, beside, or side by side. This term has been used in the naming of occupational roles considered ancillary or subsidiary to roles requiring more training or of higher status. This does not mean, however, that PTAs do not act professionally, but does represent the legal distinction between the PT and PTA. So while the PT and PTA are required to act professionally, the physical therapist is considered the professional in the role of physical therapy, and the physical therapist assistant is considered the paraprofessional. Now that we understand the characteristics of a profession, let's now turn to the International Classification of Functioning definitions for functioning and disability. This terminology is important for you to know right from the start because it frames the discussion of all the patient types we see in clinical practice. This classification system focuses on functional abilities that result from medical conditions. It is different from the medical model, which focuses on treating an ailment. Through the process of physical examination, a physical therapist determines the presence and extent of impairments, functional limitations, and disability before establishing a plan of care. So let's look at the definitions. First, we have impairments, which is a problem with a body function. Examples include pain, decreased range of motion, and/or decreased strength. So for example, if somebody has a painful arm and there's weakness and decreased range of motion due to a pathology at the shoulder, this would be examples of impairments. Next, we have activity limitations, and these are difficulties that might be encountered when attempting to complete a task. Right here. An example here would be a person's difficulty in combing their hair due to decreased shoulder range of motion in the example before. So the impairments result in activity limitations. Next, we have participation restrictions. These are problems an individual might face while involved in life situations. So this goes one step further than an activity limitation. For example, the person with the painful and weak shoulder can no longer participate in the city softball league. This would be an example of a participation restriction. And finally, we have disability. This encompasses impairments, activity limitations, and participation restrictions. Not all people suffering activity limitations or participation restrictions have a disability, but rather those so impacted that they cannot work, for example, would be considered to have a disability. So in conclusion, it would be very useful for you to memorize these definitions, and as the program progresses, you will see how they fit into the profession of physical therapy. So in summary then, there was an introduction to the class, the idea that you should look at your syllabus and schedule so to plan ahead. We looked at the definition of a profession and how this definition relates to the PT and PTA, and we also introduced the International Classification of Functioning.